What is flap surgery for skin cancer reconstruction? Imagine having skin cancer removed from a delicate area like your face or hand and needing a way to restore both appearance and function. That's where flap surgery comes into play. It's a specialized reconstructive procedure used after removing skin cancer, especially when the wound is too large or complex for simple stitches or skin grafts. The goal is to repair the area with healthy tissue that looks natural and heals well. In flap surgery, a piece of healthy tissue from nearby areas is carefully moved to cover the wound. Unlike skin grafts, which only transfer the top layer of skin without its blood supply, flaps keep their own blood vessels intact. This means the tissue remains alive and well, which helps it heal faster and reduces the risk of tissue failure. The tissue can include skin, fat, muscle, or even bone, depending on the size and location of the defect. There are different types of flap surgery. Local flaps involve moving tissue from right next to the wound while keeping it attached at one end to preserve blood flow. Regional flaps are larger sections that include deeper layers like muscle and are moved from nearby areas but still remains connected to blood vessels. Free flaps are more complex. They involve completely detaching tissue from a distant part of the body and reconnecting blood vessels using microsurgery. This allows for more flexibility in covering large or complicated wounds. This procedure is often performed after Mohs micrographic surgery, a precise technique that removes skin cancer while sparing as much healthy tissue as possible. Because Mohs surgery can leave intricate wounds, flap reconstruction helps restore both the look and function of the affected area. It's especially useful in sensitive regions like the face, nose, lips, ears, or hands where cosmetic and functional outcomes are very important. The advantages of flap surgery include faster healing, better cosmetic results, and improved preservation of function. The tissue used in flaps tends to match the surrounding skin better in color and texture compared to skin grafts. However, flap surgery is more technically demanding, may take longer, and requires a skilled surgical team. Post-operative care is essential to ensure the flap survives and heals properly. In summary, flap surgery is a vital reconstructive option that uses nearby healthy tissue with its own blood supply to repair wounds after skin cancer removal. It helps restore a natural appearance and function, especially in areas where tissue tightness or damage could impair daily activities. Patients should work closely with experienced surgeons who can evaluate their specific needs and choose the best type of flap for their situation. Always remember, personalized medical advice is key, and consulting with a healthcare professional ensures the safest and most effective treatment plan.